umbilical outpouching was considered a big problem in the herds. In the European legislation, it is stated that if the umbilical outpouching is large or if it is ulcerated, the pigs cannot be kept under normal conditions. They must be housed in hospital pens and they cannot be transported normally. They need extra bedding and extra space on the lorry as well as a health certificate, which means that these pigs are actually unwanted in the production. However, we didn't really know the extent of the problem, nor did we know why they are actually there and how we can prevent them.
Welcome to the Swine Health Blackbelt Podcast, the latest swine health research digested for you. My name is Dr. Clayton Johnson, and I'm the host of the podcast. Joining me in our illustrious podcast studios this week is Dr. Marie-Louise Hansen. Dr. Hansen is a postdoctoral student at the University of Copenhagen. Marie, thank you so much for joining us on the podcast this week. If you would, why don't we start with an introduction for the audience?
Yes, thank you for inviting me. My name is Louise and I'm a veterinarian. I have worked for the past 5 years with umbilical outpouchings in pigs. I have recently finished my PhD on the subject, and I have worked with several different aspects of umbilical outpouchings. We have worked with the prevalence, the pathology of them, and the prevention. The study was important because umbilical outpouching was considered a big problem in the herds. In the European legislation, it is stated that if the umbilical outpouching is large or if it is ulcerated, the pigs cannot be kept under normal conditions. They must be housed in hospital pens and they cannot be transported normally. They need extra bedding and extra space on the lorry as well as a health certificate, which means that these pigs are actually unwanted in the production. However, we didn't really know the extent of the problem, nor did we know why they are actually there and how we can prevent them. So this is what I worked on in my studies.
Salmonella presents significant challenges to pig health and performance and poses food safety risks to humans. As the first and only vaccine offering live attenuated strains of both Salmonella cholerae and Typhimurium, Enterosol Salmonella TC from Boehringer Ingelheim protects pigs against both serotypes with a single oral dose. Talk to your Boehringer Ingelheim representative to learn more.
I know that there's been some work done historically with umbilical outpouchings in pigs. If you would, Louise, talk to us a little bit about that historical work. What sort of research has been done in the field prior to your efforts with your PhD?
Some studies into what actually causes these outpouchings, and this is why we don't really call them umbilical hernias anymore. They discovered around 2013, they examined slaughter pigs and found that they did not only have hernias, these pigs. They could also find abscesses, they could find cysts, which are fluid-filled structures, and then they found this petal-form proliferation as well.
Very interesting. And then let's talk about your studies. I know you've done a couple of different studies, evaluating the prevalence of them, looking at the pathology, looking at intervention strategies. Talk to us about all the work you've done and what you've learned.
The first study we did was a prevalence study. So we did a cross-sectional study across 30 random herds. We calculated a sample size for each herd, and then we adjusted it with the herd size. In total, we examined more than 8,000 piglets in the farrowing unit and more than 20,000 in the nursery unit. And then we sampled the sick pens as individual herds. And what we found was that umbilical outpouchings are quite common. The within herd prevalence was 2.9%. And this is absolute minimum figures for the weaners. And they are minimum figures because we have a lot of euthanasia going on prior to the investigation, and also because sick pens were sampled individually. So a lot of the pigs with outpouchings were actually in the sick pens and not part of this random sample. So I guess we can say that we would expect higher levels than 2.9%.
How about the pathology? You did some evaluation on the prevalence. What about the pathology as you get a chance to do some necropsy on those pigs and maybe even some histopath type interpretation? What did you learn from that?
We did necropsies on some of the pigs, only the weaners. We took them. The farmers decided which pig we could euthanize. So, of course, these pigs are a little biased. It is the pigs with bigger outpouchings and perhaps ulcerated and perhaps other comorbidities. But what we did see that was that hernias were really common in the weaners. Maybe partly because we took the bigger ones, they are more likely to be hernias because the intestine fall through and make it a very large outpouching. But we also saw cysts and abscesses as well. The abscesses are probably ascending infections through the umbilical cord, so they, you can say, arrive early in the pig's life. We didn't see any of these petal-form proliferations that were described in slaughter pigs. And we did examine 200 weaners, so I guess we should have seen it if it was there. So that diagnosis is probably something that either evolves later on in life or they have smaller outpouchings, and that's why we didn't include them in our study because, we included the poorer pigs. We also saw quite a lot of complications in these pigs that were necropsied, and complications were connective tissue. More than 50% of the pigs had this, which is a bit concerning because it takes quite a lot of time to develop and tells us that the pigs have had a problem for at least weeks. We also saw bleedings and adhesions, also around 20% of each. And then lastly, we had the actual incarcerations in 10% of the necropsied pigs.
And I would assume similar genetics across all of the 30 herds that you did your prevalence and the pathology evaluation on?
Yes, all of the pigs included were from herds that used Danbred or Danish genetics, and all pigs were crossbreds between Landrace, Yorkshire, Duroc.
What about management strategies on the farms? Did you have any producers that shared any sort of unusual management strategies that they tried to put in place to minimize hernias? Were there any unexpected, I guess, findings with how producers were trying to do their own interventions as you got a chance to go to their farms?
We didn't find anything there. We did actually look for it because we wanted to know if someone had a brilliant idea for reducing the hernia. But they didn't. But all of them did various schemes of antibiotics at birth. Then some had some disinfection. Some used different beddings in the pens and disinfection there. But nothing really that could explain a high or low level.
Yeah. You mentioned antibiotics at birth, and I know that's a very common strategy worldwide to try and minimize the ascending infections of the umbilical cord that you mentioned. Talk to us about your third trial, the interventions that you looked at. What were the different strategies you looked at to try to impact the prevalence of these outpouchings? And then ultimately, did you see any impact?
We did a clinical trial in one large herd with 1,800 sows. We had 3 different groups. First one was a control group who didn't receive any treatment. Second group was an antibiotic group who received amoxicillin at birth. And lastly, we had our experimental group where we disinfected the umbilical cord before we tied it off and cut it. And then they were also injected with meloxicam. And then we looked at the prevalence of umbilical outpouchings as well as the mortality from birth and until departure from the nursery unit. We had more than 5,500 piglets in the study, and we didn't see any differences between the groups. We had relatively the same mortality. in all three groups, as well as the same prevalence of umbilical outpouchings. And the prevalence ended up being 4%, and the mortality, I think it was 21.8% in total across the groups.
It's a frustrating problem to have because I don't know that anybody has a perfect silver bullet for it. I asked you about the genetics, Louise, and you kind of shared that there were similar genetics across the farm. But what about gender? Did you notice anything different with prevalence or with the pathology between the males and the females that were on this study?
Most of the pathology study is done on female pigs.
Okay.
So we didn't have the prevalence of sexes in the two larger studies, the 20,000 pigs. But I guess we can assume that 50% of them were females. And therefore, we did see a lot more umbilical outpouchings in the female pigs. And this clinical trial, we knew exactly if they were male or female. And females did have, I think, an odds ratio of 1.7 compared to male pigs for developing umbilical outpouchings. On the contrary, we didn't see any effect of the treatment group, of the birth weight, whether they were born as intrauterine growth restricted piglets or cross fostering. None of those had any effect on the prevalence of umbilical outpouchings, but they did affect the mortality quite a lot across all of the groups.
Yeah. But it's very interesting that you observed more outpouching incidents in the females, and I'm sure that leads to ideas for more studies in the future. What would be your message, Louise, for veterinarians, for researchers that are thinking about doing more research in umbilical outpouchings in the future? What would be your I guess, direction for how to get the most value out of future studies going forward?
I think it's very important when you design study that you try to look at what others have done and try to mimic their studies. So you should use probably the same definitions for when do you actually register an outpouching, how large should it be, when do you refer to it as large or small. And also you must remember that you cannot do a study on a 1 week batch because there is so much batch effect. So you need to have studies running across several weeks. You also need to have an extreme amount of piglets because it's a relatively rare disease. And then you need to remember that there are different types of umbilical outpouchings. Probably you can prevent some of the abscesses if you use antibiotics, but the hernias, they might originate from something entirely different, and especially the cysts are expected to be some sort of developmental defect, so they probably originate from something that could be genetic. So it is quite a complicated disease to deal with.
Yeah. Well, kudos to you for observing that many pigs. Looking at thousands of pigs for any sort of project is difficult, and especially something like this where it's palpation involved, a lot of very intense observations. A lot of work went into it, and I really appreciate you coming on the show and sharing what you learned with our audience.
Thank you.
Well, thanks to our audience. We certainly couldn't do this if we didn't have folks listening in. So appreciate all of you that have listened into this episode and all the episodes that we do. If you haven't been to our website, please do go to swinehealthblackbelt.com where you can see Louise's episode as well as all the other episodes that we put out every single week. For Dr. Marie-Louise Hansen, I'm Dr. Clayton Johnson. It's been our pleasure to bring you this update on umbilical outpouchings, and we hope you have a great rest of your day.